Hello, it's Philippa here from Chris and Philly Functional Medicine. I'm doing a video today all about histamine. And this video was actually based on an article I wrote for Natural Medicine Week, which is happening next week. I'm an ambassador for the Australian Traditional Medicine Society, and I'm going to actually put a link down to the Natural Medicine Week website so that you can look at all the amazing content that practitioners across Australia are providing. There's lots of free webinars or low-cost webinars and events that you can also attend. It's going to be amazing. So anyway, I want to talk about histamine. So what does reflux, anxiety, and itchy eyes, skin have in common? These are actually all common signs of histamine intolerance. And when I'm sitting with someone in a consult, meeting them for the first time, if they have these three things or a combination of histamine type symptoms, I might start suspecting histamine issues. So histamine is a substance that is made inside the body as well as in certain foods. It's normal and natural, and if your body is balanced, and you can then easily excrete any excess histamine. If, however, you have imbalances in your body that are increasing your histamine load, you can actually develop histamine intolerant symptoms. So other symptoms include allergy-like symptoms like a runny nose, sneezing, hives, asthma, chronic cough, as well as gut issues, headaches, joint pain, fatigue, and insomnia. A lot of symptoms. So histamine is actually found inside almost all areas in the body, in all the tissues in the body. It's stored in the granules in mast cells as well as in white blood cells. So mast cells, are especially high in areas of the body that are more at risk of injuries. So things like your nose, your mouth, your feet, your gut lining, and your blood vessels. And histamines are amazing. They act like soldiers in your immune system. They stand guard and fight against harmful substances. These could be food allergens or dust or pet hair or pollens or harmful toxins. When you are exposed to these allergens, histamines release to fight against the inflammatory substances. Histamines also, they're not just about the immune system. They also play a role in your day-to-day functioning of your body. It controls your heart rate, your gastric acid production, and even your appetite. So histamines aren't bad. They are natural and normal, and they do help us to thrive. However, when they have reached a high level in the body, you can develop what is called histamine intolerance. So a lot of people, ask then, well, what are the root causes of histamine intolerance? Why does it happen in the first place? And there are a few key factors that can lead to an excessive buildup of histamine. So one of these is dysbiosis. So some pathogenic bacteria and yeast species in the gut produce histamine during fermentation. And when there's an overgrowth in these species, it increases your overall histamine load. You can also have enzyme deficiencies. So there are specific digestive enzymes in the gut lining that help to break down histamines, especially in the food that you eat. And if these enzymes become damaged, which is common when there is inflammation in the gut, you can struggle to break down foods high in histamine. Also, you might have nutritional deficiencies. So things like vitamin C, B2, B6, and copper are all important nutrients to help break down and clear excess histamines. Deficiencies could occur due to poor diet or gut issues, inflammation, or even genetic mutations where you're just burning through those nutrients or not using them properly. Another thing which not many people know about is estrogen dominance. So your estrogen hormone estradiol can actually increase histamine and vice versa. So if you have estrogen dominance, which is often caused by poor detoxification, this could cause histamine buildup. And then lastly, something else that can cause histamine intolerance is stress. So when you're under whether it's psychological and or physical stress, histamines can be released. And chronic stress then can cause chronic histamine excess. So the big question a lot of people also have is, well, is eating foods high in histamine bad? You might have noticed I didn't mention foods high in histamine as being a root cause. That's because I believe that a healthy body should be able to eat all healthy foods, including foods high in histamine, without any issues. So no, I don't think eating foods high in histamine is bad. However, if you have a histamine intolerance, you will do better on a low histamine diet for a short time to reduce your load, reset your system while underlying root causes are addressed. So in our practice, I've seen histamine symptoms reduce dramatically within a week or two. I've had clients who were experiencing asthma and reflux and anxiety and headaches, see a complete disappearance of symptoms when they've gone on a low histamine diet. So I'd like to go over how you can actually use a low histamine diet for therapy. So if you suspect you have a histamine intolerance, or if I do in practice, I usually advise trialing a low histamine diet for 2 to 4 weeks to see if it improves symptoms. So during this phase, you will want to avoid the following high histamine foods. So in terms of protein, seafood, pork, eggs, aged meats, and dairy products are all high in histamine. So are capsicum, eggplants, olives, spinach, tomato, fermented foods, drinks, bananas, dried fruits, citrus fruits, lemon, orange, tangerine, avocado, kiwi, raspberries, strawberries, pineapple, papaya. You probably think, holy crap, that's kind of like all the yummy fruits that I eat. No wonder I'm so itchy. As I'm reading through these foods that are high in histamine too, just take notice as well. Like, are these foods high in histamine? Do you have some of these histamine issues? If yes, then you might want to check out my associated blog post on the Natural Medicine Week website and you trial doing this low histamine diet. Gluten. So in terms of grains, gluten containing grains high in histamine, so you'd want to stay clear of those. Legumes, soy, green peas, red peas, sugar snap peas, and sweet peas are all quite high in histamine. Actually, I had a client who had like the little green beans that you boil, like the frozen peas, and she said, yeah, every time I have those, I have like an itchy rash straight afterwards. All nuts and seeds except macadamias and coconut are high in histamine, which is very interesting because sometimes people can, or we might start just like a healthy whole food way of eating with a client, and they've gone from eating more processed foods, and a lot of the times people start eating more nuts and seeds as snacks, and or they might use that to make bread or crackers. And if someone feels worse on a healthy whole food way of eating, especially of eating lots of nuts and seeds, that's where I might start suspecting, are there actually histamine issues? In terms of beverages, alcohol, caffeinated drinks are quite high in histamine. Some of the sweet stuff, chocolate, sugar, maple syrup, sugar alcohols, artificial sweeteners are all high in histamine. And so too are things like pepper, cinnamon, cloves, nutmeg, cardamom, so all those lovely, wonderful spices, high in histamine. And most fats are fine. You just kind of want to stay away from soybean and palm oil. So as I've been reading through that, I mean, a lot of people eat all these foods, and I'm not saying that they're bad. It's just that they might be contributing to a histamine issue, and you might need to just lay off those foods for a time. Another thing too, bone broths, amazing. Fermented foods, amazing. But fermented foods are very high in histamine, and so are bone broths. So again, you might be on the healthy bandwagon, fermenting all the things, having bone broth for like your gut lining, and you may feel worse. I'd start suspecting a histamine issue. So if after the 2 to 4 week elimination you don't feel any improvement, you likely don't have a histamine intolerance. Bringing back all the foods, or bring back all the foods and see how you feel. If, however, you feel an improvement in symptoms, or your symptoms flare up when you bring back the foods, this is a strong sign that you have histamine issues. And I would encourage you to work with an accredited clinical nutritionist, functional medicine practitioner like myself, to address underlying causes and help you to reintroduce high histamine foods safely and effectively. And don't worry, most people are able to bring back most, if not all, histamine foods without ongoing reactions. So after those root causes have been addressed, you will be able to eat avocados and nuts and cacao again, I promise. P.S. If you want more info on this, especially like the food side of things, so you can implement that, jump over to the Natural Medicine Week webpage. I'll put a link there straight to my blog. And also I'll put a link to one of my favorite low histamine zucchini bread recipes, so that you can see that you can still eat yummy foods while you're on a low histamine diet. Let me know how you go. If you end up implementing the low histamine diet and feel better, I'd love to hear it. I'd love to hear about your experience. All right, see ya. Happy Natural Medicine Week for next week.